So as you ask us questions and we try to help make sense out of everything, please bear in mind that this is a unique organization and we're really, really busy. We don't often have lunch breaks. We don't pee. We cry. We have breakdowns in the hallways. CB has held up many a nurse in the day. I have as well, and for good reason. So now that you have that out there, and I've worked in community hospitals too, so I've seen it all. And CB stayed at Cedars true and tried, and we love her for that. I don't know how she's done it actually all these years.
Because I like it. I really like to, I love it. I love taking care of the patients, and I know, I'm a doula at heart also. And when I'm in the hospital, I'm a nurse. And when the doulas come to the hospital, there's plan A, plan B, and plan C. And all the patients want to sign up for plan A at home with the midwife in their bedrooms with their husbands and maybe their mother. And when there's plan B, when you come to the hospital, it's because you want something that the hospital has in addition to your doula-ship. You see? And then that's where we have to come together to offer that. And a lot of times the doula have more time with the patient and they feel connected. And what she's given them is good. But when you come to the hospital, there's something that we have to give you. Do you know what I mean? And sometimes they get into, well, I'm going to take this, my doula, my nurse, and, my doula, is she, my nurse, does she really want to do this really speedy because she wants to do it speedy, or because she has to do it? You see? And sometimes that's where we, have a little uphill with the doulas and the patients kind of get confused as to who is who doing what, like who's in first and who's in third.
I just have first of all, a comment is that you guys are amazing. That exactly what you said was that you're interfacing between the patient's needs and the doctor's needs and the administration's needs, and it's an incredible job. And I just wonder if most patients realize, they spend so much time selecting their doctors. I've got this doctor, and that's going to be the magic doctor. And they never go into labor and delivery and choose their nurses. And so you can't, and that's who's going to be taking care of them for the majority of the labor. And the doctors will be calling in the orders, and I think there's a lot of mystification with patients coming in. It's like, where is he, or she, and he called it in, why, and I think it's so unexpected. And
I know, because the doctor says, I'll meet you there, but not, he's going to meet you there at some time. He's going to meet you here if he needs to meet you, and when you need him. Not all the time, because he runs an office, so imagine each little call he's there. Nothing will ever get done. And I think like the education that happens out of the hospital before should include, like, when you go to the hospital, why you go to the hospital, how hospital, things operate. It's not, if I'm home, it's just us. But when you go there, they're like people that are going to have to, and there are rules and regulation. A lot of times when the ladies come and they want to, say like, do this, I said, well, do you work? It says, what do you do? You see what I mean? And then, like I said, imagine if I went to your office for something and I wanted to tell you how to run the situation, and then they laugh and, they relax, and then they, maybe I have to do this now because, you know what I mean? No, but everybody wants everything like rapid or right now. And, if all these things were talked about before, how it goes in the hospital when they're like really not in labor, then I think when they come in and this happens, they'll get recall, not instructions right now. It's, my daughter told me about that, my doctor told me about that. But in the office is, don't worry, darling, everything is going to be totally fine. They never talk about if you do it in the summer, Maybe the hospital may be so full, it's not like you can make a reservation. Maybe that reservation, the one kind of reservation that we make, that's called induction, sometimes those have to be canceled. And, that's like a, big, devastating. They cannot understand. I made a reservation, I know.
I want my baby today. I'm having it at 2.
Yeah. And all that becomes a big disappointment. That's not what I signed up for. I signed up for an appointment. But if you talk about that before, when they're in the classes, when they're getting prepared for this, it's like, earthquake preparedness. And they can, be prepared for that.
And you should.
That's what I try to teach in my childbirth education classes is to normalize, the experience. So people are coming in with more reasonable expectations, not with some, unreasonable fantasy of what they think it's supposed to look like.
Along the same lines, many of you mentioned about the breastfeeding, and I also do a lot of lactation consulting, as many of you do. And one of the things that they also want is to breastfeed right away after the baby comes out. And they can't do that. Nobody realizes, unfortunately, whether it's situation of the position of the mother, the condition of the baby, that we can't always make that happen right then. So we try to say to our patients all the time, don't worry about it. We'll get that taken care of. That'll happen for you. And everything is a progression. And we like to hope that that information is out there, that the way you got pregnant, or somebody got you pregnant, in many of the cases, which is really true, and how this whole experience is going to go is progressive. And it will get to wherever that end is going to be, and it'll all be okay. I mean, we're all trained to try to handle as many situations as possible. Let her ask one question.
First of all, I think it's a real privilege for you guys to be here, for us to be able to ask you. First of all, thank you very much. To ask you what we can do in order to make your jobs easier when we arrive at the hospital. I've done it on a personal level with different nurses that I've met through the years. In this area more, not as much in the city. But how can we help you? What do you need from us when we arrive at the hospital?
I have one thought, and this stemmed out of a conversation that I had with one of our other nurses who knew I was going to be here today. And it's a specific example, but many of you will have patients who maybe started out at home and intended maybe for a home birth, or intended to be at home for a long period of time before coming to the hospital. And women will come to the hospital for pain relief because they are understandably active in their labor, and they're reaching a point where they've been doing this potentially for many hours, potentially days, and they need relief. One of the ways that you can really help support both in education beforehand and at the hospital is patients are often unprepared for the fact that we are all about getting them pain relief if that is what they need, but that takes a while. It takes some time to get their intake done, to get that IV started, to get anesthesia in there, to get relief after that point. And I think, having been in active labor before, at that point you're just like, I need it now. And so, as far as education beforehand, it is invaluable for you to be able to speak with your clients and let them know, here's what we have in way for pain relief. If we're headed to the hospital, know that it could take up to an hour before we can get that epidural in you, or get fentanyl, whatever it may be that they wanted. That doesn't happen. You can't always forecast an hour. Patients go from 2 to 7, and they need it as soon as possible. In that moment, providing that emotional support, helping keep that patient focused, working with us as we're scrambling to try and get what little intake we can get by with to get some pain relief. We'll get the rest later. But in that moment, helping keep mom as focused as we can, helping keep dad calm, because goodness knows that's a panic moment for dad. My wife is in pain. We need something now. And being that source of focus and calm in that moment really helps, because everyone wants to panic then. And so helping keep them prepared ahead of time. Let's plan ahead of time. We're getting active. What are you thinking for pain relief? And sort of forecasting out, and then helping us stay in that moment. if a patient desires pain relief in the hospital and does plan on getting an epidural, after that point things are usually calmer. And, there are lots of things that we really benefit from you guys being there. Ongoing, massage, comfort and touch, comforting words. Patients get bored after they have an epidural and they start getting restless. So that emotional support is totally valuable there. But we love viewing the moments when they come in screaming and huffing and puffing and trying to just make it to an epidural, and you're able to help be a source of focus for us.
Because really working together is the goal for all of us.
Yeah, exactly.
And have a win-win situation.
I think I just recently had a couple of natural patients right next door to each other, so I was kind of bouncing back and forth. So having the doulas I could not have done it without the doulas. In the old days, I guess nurses, could actually take care of a naturally laboring patient if that was the only patient. But it's just not a reality anymore. So thank goodness that there are doulas and both, coaches and assistants. But one room had one energy and the other room had a totally different energy. And I'd say the thing that was the most frustrating for me was when I needed to get to my patient, I couldn't get to her because she had two doulas, and when the baby was having a deceleration, I could not get to her to flip her, get the oxygen. So I want to feel like she's my patient too. I want to feel a part of the team. I don't want to feel like just the nurse who comes in to chart on the computer and the bad guy or the heavy or the symbol for the machine. Because I think that the nurses are just amazing women. They really are, and I don't think any of us want to feel that kind of that feeling like we're in the way, or we're really. It would be better if we just left her. And that's sometimes how you can get that. You feel that with some, and so certain doulas start to have a reputation with nurses, and certain and it works that way. But I'd say I want to be able to also be hands-on, because I was a massage therapist. I love touching my patients. I love touching the nurse. I touch her. But I want to also feel like I'm there with something to give to.
I would like to make I would love for you to ask one more comment, just tailing off of that. Some of you were mentioning 2 years, 10 years, whatever, some of 30 years. We've evolved as a group of nurses in this field because of our patient population, who has also changed from when we started. Our patients were generally 22 to 28 years old. They're 45 and older. Their care is very different. And so we have evolved as a much more medically oriented type of population of nurses, as opposed to where we all had our ABC rooms and everybody did natural and our doctors sat at the bedside and we touched them and we loved them and we held them and we rubbed them. And not that those days are gone, they're not gone, but the focus has changed somewhat as our patient population has become more acutely high risk and with different needs, and in vitro and IUI and all these other things that are happening with our population as well. So that does change. So Leslie had a question.
You need the two people to do the same. Yes, it has to be a group effort.
Yes, it is. And the doulas evolved out of that need as we as nurses backed off, became more technical, and we had other people step in. Leslie had two questions. And Leslie worked with us as well at Cedars as a lactation consultant for many years.
Are there midwives on staff now in labor and delivery?
Yes.
Have you told that?
Yes.
What is their responsibility or their role?
Well, they work with the patients just as midwives, and they help the doctors with manage the patient with during labor, and if for any reason the doctors don't get there in time, they deliver the babies.
So does the patient request the midwife?
We don't have that many patient request midwives. Some of the patients come in with their own midwives. The midwives work at Cedars now, so they have midwives that have outside practice that is affiliated with the hospital, and they come and they manage their patients under the direction of a doctor if needed.
So if I